do it.
Okay, we're starting the live event.
Right, I'd like to call this Health Policy Committee meeting to order. Today we are meeting jointly with the Anchorage Assembly and the Anchorage School Board. I'll have the clerk's office call the roll for Assembly members present and then turn it over to ASD to call the roll for school board members who have joined us.
All right, Miss LaFrance.
Here.
Miss Solitel.
Here.
Miss Allard. Mr. Constant.
Here.
Mr. Dunbar.
Here.
Mr. Rivera.
Present.
Thank you.
Actually, Carissa, could you call for any other Assembly members who may have joined us that are not on the committee, please?
Sure. Is Miss Kennedy with us? Okay, Mr. Perez-Verdia, are you joining? Okay, Mr. Peterson? And Mr. Weddleton? Okay, that's all I have.
Great, thank you. And if the school district would like to do a roll call?
Good morning. This is Elisa Vikalis, the president of the Anchorage School Board. We've got a couple of folks that are in as observers, so I will go down and call their names, but I don't know if they're going to be able to acknowledge, but I'm certainly present. Is Vice President Bellamy in with us today?
Present. Can you hear me?
Yes, thank you.
Okay.
Board Member Marcette?
Yes, I'm here.
Thank you. Board Member Donley?
Can you hear me? Yes, I'm here.
Thank you. Board Member Hildy? We're working on getting her help, but she is an observer right now. Board Member Mitchell?
Present.
Board Member Holloman?
I'm present.
Thank you. And I believe that is all of our board members. We also have Superintendent Dr. Bishop with us as well.
Thank you, Madam President. So before we start with new business today, I just wanted to set the stage here. As we know, the school district and the municipality both exist within our community, and the actions either take, particularly during COVID-19, greatly affect one another. So we wanted to create this opportunity to have a chance to talk together and see how we can come together around our community's response to COVID-19 and talk about both the municipality's COVID-19 response and get an update from our health director, Heather Harris, and our epidemiologist, Janet Johnson, as well as then talk about the ASD reopening plan. So today I invite all board members and assembly members to participate. You may put yourself in the queue by using the chat feature. And what we're going to try to do is get through a presentation under new business. We'll do A, which is the general COVID update, take questions there, shift to B, which is the municipal response and ASD reopening plan, take questions there. And then I also have under B, several representatives from various unions within the school district who would like to provide some brief comments as well. So we'll do our best to get through this. I have the feeling we will use up our time, but we'll try to move quickly through to be able to really dive into questions that individuals may have. All right, with that, Director Harris, would you like to go ahead and share your presentation or your update with us?
Heather, we can't seem to hear you.
Can you hear me now?
Yes, thank you.
Okay, perfect. Thank you. Settings on Teams. Thank you. So just a big thank you for this opportunity to have this conversation with the Assembly and the school board. I just want to say a big thank you to the Anchorage School District and the work that we've done over the last several weeks and months to prepare for a strong and safe reopen for schools. As you said, Madam Chair, we'll start with a conversation and just sharing our weekly report of the status of COVID, and that'll be provided by Dr. Janet Johnston. First, I'd like to introduce Dr. Janet Johnston. She's an epidemiologist with over 20 years of experience in public health and applied health research, and she currently serves as the epidemiologist here at the Anchorage Health Department. Previously, she served as the Community Systems Program Manager and Clinical Services Supervisor here at the Health Department, and she's also served as the Director for the Division of Population Health Sciences at UAA and as an epidemiologist with ANTHC, the Epidemiology Data Center at the University of Pittsburgh, and the National Institute for Occupational Health and Safety in Morgantown, West Virginia. Dr. Johnston has a PhD and an MPH in epidemiology and graduated from the School of Public Health at the University of Pittsburgh. And so she's going to share our health update. And I'll turn it over to her.
Thanks, Heather. So I'll just dive right in. As of yesterday, there are 8,922 confirmed cases in the municipality. This includes 8,676 Anchorage residents in and out of state and 246 non-residents. The average number of new cases in Anchorage over the past week has been 183, and the highest single day count by onset date since the beginning of the pandemic was 238 cases on October 30th. The rolling average has increased steadily, the average number of new cases per day since early June. We had a relative peak in July, followed by a decrease that held through the summer, but we've seen a steady increase in September and a much steeper increase over the past 3 weeks. Approximately 3% of Anchorage residents have tested positive for COVID-19. This percentage is slightly higher in the 20 to 40-year-old group and slightly lower among seniors and also among children. Given that many cases are asymptomatic and not all symptomatic cases get tested, this is clearly an underestimate of the actual number of residents who have been infected, but we do not know how much of an underestimate. The current estimate for the reproductive number in Anchorage is 1.2. This is a measure of how much transmission we're seeing within the municipality. And basically it means that on average for every 5 new cases this week, we expect 6 new cases in the weeks to come. You've likely heard that hospitalizations are a lagging indicator, and we are starting to see that here. The steady increases in cases since early September is now reflected in steady increases in hospitalized cases since mid-October. Hospitalizations have been increasing steadily since mid-October. There are currently 55 COVID-19 patients hospitalized, as well as 7 suspected COVID cases. Approximately 10% of hospitalizations within Anchorage are related to COVID. And there are 17 COVID-19 patients in the ICU in Anchorage and 8 on ventilators. I should note that the ICU patients come both from Anchorage residents and residents across the state. Unfortunately, along with the increase in cases, we're starting to see an increase in deaths. There have been a total of 51 deaths among Anchorage residents. 14 of those deaths occurred or were reported during the month of October, and 37 have occurred since August 1st. The next thing I want to talk about is testing. While the number of cases has been increasing steadily, testing volumes have not been keeping pace, which means that the percent of tests that are positive has been increasing. Ideally, we'd like to keep the percent positive under 3%. This helps us know that we're doing enough testing to detect virus within the community. And aside from a peak in the percent positive that occurred in July, Anchorage stayed below 3% from April through mid-September. However, we crossed over 5% in mid-October, and we're now just over 7% of tests coming back positive. Some of this increase may be due to delays in reporting of negative test results, but it is also clear that more testing is needed. There are also some concerns about test turnaround time, although we have seen some improvement this week. Currently, the state lab is turning tests around in an average of just over 3 days, and the commercial labs are averaging just over 2 days. The faster we can get test results back, the sooner we can get individuals into isolation and ask contacts to quarantine. Regarding personal protective equipment, we continue to see a need for some healthcare providers to access PPE through the emergency operations centers, but in general, the EOC is able to meet these requests. The biggest issue recently has been a nationwide glove shortage. And in terms of public health capacity for interviewing cases and getting contacts into quarantine, our goal is to interview or outreach to cases within 1 day of receiving the assignment. For much of the pandemic, we've been able to meet that goal. However, recently we are frequently carrying cases over to the next day. Also, not all cases are willing to participate in an interview. Last week, approximately 80% of new cases opened in the monitoring system were interviewed, and 80% of those interviews were completed within 1 day. Our case counts are so high that it's difficult to know exactly where transmission is happening, and in general, it's best to assume that it's happening everywhere. The most commonly reported exposures are within households, at gatherings with family and friends, within places of worship, and at places of employment. While it's relatively easy to determine if an infected individual has been at a given location, with so much mixing within the community, it's harder to say exactly where transmission is occurring. And that's my report. I'm happy to take questions.
Thank you so much for that. So again, if there are questions, please jump in the queue. We'll take questions now for the health director and epidemiologist if there are. I'd like to note for the record, Mr. Weddleton joined us around 10 a.m. And we can also circle back for questions to both ASD and the health department at the end if that's what the board members and assembly members would like to do. All right, I'm not seeing any questions in the queue just now. So why don't we go ahead and turn this over to the school district to go ahead and give it.
This is Dave Donnelly. I have a question.
Oh, yes, please go ahead, Mr. Donnelly.
Yeah, how are we establishing or measuring the COVID deaths? Are they folks who died that had COVID or folks that died because of COVID?
So that determination is usually made by the physician or the medical examiner, but in general, it's as with any cause of death, if it's considered a contributing factor. So an example would be someone may die of pneumonia, but the pneumonia was caused by the COVID infection. That would clearly be a COVID death. On the other hand, you could have somebody who has asymptomatic COVID but has tested positive and dies in a car accident. That would not be considered a COVID death. And I have certainly seen cases where the medical examiner has come back and said, no, that death didn't have anything to do with COVID. One example would be a homeless individual who died from failure to thrive. She had had COVID and had been hospitalized a few weeks earlier. However, it was not deemed a COVID death because of the amount of time between her recovery from COVID and when the death occurred.
Thank you.
Great. Any other questions for the health department or epidemiologist at this moment? All right, I'm not seeing any, so I'm going to go ahead and turn this over to the school district. You should be able to go ahead and share any presentation you have, and just be sure to introduce yourselves for us. Thanks.
I believe our President Michaelis, were you going to speak first, or?
Yes, I was just trying to find all the buttons here. Am I on and everybody can hear me?
Yes, please go ahead.
Thank you. So I wanted to take this opportunity to just say thank you for allowing us the opportunity to provide information about the school district plans to reopen schools to in-person learning. We understand there is a great deal of emotion and politics surrounding this issue. We also understand the pressures the Assembly is under as it too navigates these uncharted waters during this pandemic where there often feels like there is no win-win. Our mission as a school district, as you know, is to educate all kids for success in life. And today that requires being innovative, modifying how we do things, and doing everything humanly possible to keep our students and staff safe while providing all of the education options our community needs. Today, I've asked the superintendent and her team to do a brief presentation to update members of this body and to answer questions. Knowing there is limited time, we have provided a white paper with additional information, and we encourage everyone to go to the asdk12.org website for further details on individual schools in your districts. And so at this time, I would like to turn it over to Dr. Bishop and her team. And thank you so much for inviting us today.
Yes, thank you, Madam President and Assembly Member Zelatel, co-chair of the Health Committee. I appreciate this opportunity to share. And what we received about 20 questions yesterday. Thank you so much for forwarding those. We were able to capture the responses and from other publications and have created what we call the white paper so that it can be referenced by the public in case they didn't, hear or additional information is needed. We put some URLs there. So we did send that. Hopefully it can be posted as well, and we'll post it on our site. What I want to share with you is just a brief of the latest re-entry. And what I'm going to address outside of the others in their particular expertise area, whether that's, the operations side of it and the health side of it, is really about education. And I want our community to know the greater picture. We absolutely understand the health crisis in our city and understand our lane and my lane as the superintendent of the school district that oversees the educational outcomes for over 40,000, nearly 45,000 students. And our goal is to do our very best. And then it does look very different than it ever has. Our employees, teachers, primarily aides, those that are really school-based, are doing an outstanding, enormous job of creating positive outcomes for kids. But it's become ever so clear that we are not meeting a lot of those outcomes. We shared attendance data last night of just our K2, who we have a plan, and certainly in our most vulnerable groups that we presently struggle with equity of access and equity of outcomes, there's even a greater divide. We know that in this high number case around our city, we cannot bring schools back, carte blanche, full bore, let's just have school like it always has been. And so we had to ask ourselves, what is the urgency now and the risk now compared to that risk over generations and over a lifetime of a child? And there's a very distinct opportunity, very discrete, evidenced by research in our young children about learning to read and having the fundamental building blocks to be able to continue to learn. Those that have the services at home where their parents can work directly with them, with their teacher, are progressing. And we've demonstrated that and we see that. However, Anchorage isn't, we're not monolithic. We're not all the same. And we are seeing a greater need for outcomes for our children. If we miss this opportunity to take care of our young, the negative outcomes of mental health, crime, and all the other things that we so very dear in our city take care of. We notice that through the CARES Act funding. We take care of those that really have struggled. And so this is an opportunity for Anchorage School District to look at what is it that we can do and what is it that we can't do. Therefore, we have only recommended our high needs students who are served in a self-contained classroom, which actually has higher supports if you're not familiar with that term, as well as our K2. These are our students, number one, that are in the smallest classrooms already. Many of them will make a decision, their parents, whether they come back or not, creating operational sizes where we can mitigate the risk, confidently mitigate the risk of the virus, as well as those students who at home are not self-sufficient on learning through a computer screen. There's a great deal of evidence around learning. In my 31 years, I want to share with you that I want to work and will recommend to the school board that we work within the parameters of our emergency orders. But we do have a crisis. In addition to the health crisis of COVID, we have a life crisis and a health crisis in our families and at home. Therefore, we have put together a very measured approach, very small approach, to see what we can do for our families in Anchorage at the minimal, given the case rise and the understanding of how COVID spreads and the emergency around us. With that, we're just going to share briefly 30,000-foot view of what that looks like. And we're just going to share glimpses of our website, and we hope that you can go there as well. I'll turn it over to Dr. Stock, who's led the instructional work. Thank you.
Thank you, Dr. Bishop. And so my name is Mark Stock. I'm the Deputy Superintendent, as Dr. Bishop mentioned. And I was charged with our instructional team to help sort of lead the district level planning. And I can tell you right now, it has been a constant state of planning since March of the spring. And so from the very beginning, one of the things we acknowledge about this strange pandemic world we're in right now is that there was no one great option and no one great decision that will be right for every family, for every student within that family, or for every employee or employee group. And so it behooves all of us to work through the decisions that lie within our areas. And so one of those needs then was, what do our families and parents think? So we did an ASD back in school survey. It was not an exhaustive survey and it wasn't perfect, but our main goal was to identify within the 3 major programs that currently exist in our district what the actual wishes of the parents were. So I won't belabor this particular chart other than to point out a couple things. There are 3 major programs, of course, the district runs. At the top, you see one called ASD at School. That's our terminology for what we would have called pre-pandemic. We would have called school as we know it. It is school that's either face-to-face or in its current version right now, it's actually remote, but it's still part of the regular enrollment program. It's just that right now it's all happening through Zoom and at home. We have another program we call ASD at Home, which is a homeschool program, which is, we also call it ASD virtual. And these are families who opted to be completely offline and to do theirs in an asynchronous format, or in some cases with some live teaching. But ASD teachers are running it and they are teaching, and it is a homeschool program, but it has left students attached to their neighborhood school by enrollment so that we can identify them that they are still at Fairview or Bear Valley, etc. Then you see a third column that says ASD homeschool. These are folks that are in Padea, Family Partnership, or Frontier, which are the traditional long-standing homeschool or correspondence level type programs that have existed for some time. Those are the 3. Then you see a column called Other. So to read this chart, you'll see in the total number of surveys submitted. This is running over 50, between 50-54% of the families surveyed filled one out for their children. So these actually represent students, not families. Families could take it as many as 5 or 6 times for each child in their family. You'll see at the top the number 4,770. These are the families who are currently saying to us that my child is in the at-school program, the normal program that was affiliated with the school, but it's currently remote. We asked them, what's your intentions for the future come November 16th? What do you plan to do? You'll see the green arrow showing that 4,280 of them say they intend to stay or return to school physically when school opens. about a 500 student drop, roughly 10%. You'll see a number 539. Those are the families who said my child is in the current virtual program, completely asynchronous and offline for the most part. 742 plan to do that for November 16th. So about 200 say they are going to switch if we go back to school face to face. Now, ironically, this number actually hasn't risen in our actual enrollment. So families are telling us that's their intention, but they've yet to pull the plug and say yes. They're still weighing options, evidently. And so that's how to read the chart. Next slide. So just some bullet points from that. I mentioned the ones at the top. I want to cover one called Other, and you'll see the third bullet down talks about 94 who selected Other. And in the future, 338 chose Other and then chose to put some information in the text box about their thoughts. 169 of those who picked Other did not leave any information or comment about what Other meant to them. 64 said that they were undecided or unknown. And interestingly, there were about 100 or so that I want to keep doing something similar to what I'm doing. I like my teacher. I don't want to leave the classroom, but I don't want to come in physically. So what do we do with those? So we had already stood up some version of an absence program that we were working on for families who might be quarantined for some time. And so we are working on how we could keep those families connected. And so that information came as a result of the survey. So we are now working on some options where a family might, for a while they quote, wait and see approach, might look and see how things are going before they choose to switch to virtual or return. Next slide. So some have asked, well, how are the different demographic groups doing in the district? Well, this is only a look at the schools that are from higher poverty areas, which we call Title I schools. These are schools that receive Title I federal funds and have a high proportion of families that are on free and reduced lunches and therefore higher poverty. And the green arrows simply show at the top, you'll see all the data collected in the survey, and you will see that 87.7% of those from all the district said that they are currently in an at-school program. You'll see that number dropped to 78%, which is that roughly 10% range we were talking about of families who still say they want to come to school. So literally, of all the families that are in our at-school program, almost 90% across the district say they intend physically to return. How does that play out between our poor schools and our schools that are considered non-title? You'll see some slight differences, but not near what people might have imagined. So looking at non-title, you'll see 80-79, and if you look at the title schools, 87.9% are currently saying they're in the at-school program, and you'll see 75% of them still intend to come in physically to our schools. Next slide. So at this point, we'll switch a little bit.
Mr. Stock, I'm sorry to interrupt. I think since we haven't had a lot of questions show up in the queue, do you mind if we go by slide?
No, that's
okay.
Fine.
Could you go back to the last slide, and then Mr. Dunbar, if you'd like to ask your question.
Thank you, Madam Chair. So Mr. Stock, you said something there that I caught, and I'm not sure if I'm understanding the survey exactly. You said up to between 80 and 90% of the parents want their student to go back to in-person. But is that actually what was asked on the survey? And I legitimately don't know. Was it asked, do you want to go back in person, or was it, do you want to stick with your teacher? They're going back in person. Will you follow them? Versus, would you rather have your teacher teach virtually or teach in person, or choose this other program that's not with your current teacher?
It's a very good question. The question was actually just built around the program with some descriptions in the survey that tried to explain the terminology so that families weren't confused about what a ASD at-school program was. And so basically we put in parentheses things like this is currently being taught remotely through Canvas. the plan on November 16th is to return to school. Do you intend to stay with your current program that you're in, or switch on November 16th, knowing that November 16th is the plan to return to school? That planning about who was returning was built into the background information at the top. But as always, as you know, we don't always know what parents are thinking or how they interpret things when they answer the questions. So I think the only thing we can reasonably infer is that they're currently in that program and they know that school is opening and they want to stay in that program. There were families under other who listed some descriptions of what they were thinking. And that's why we realized we need to have some options for families while they don't return, but they keep their teacher, and until they figure out what they're comfortable with. And so, like I said, it's hard to know what every parent thought, but the questions were focused on the survey programs, not necessarily about your current teacher and all those other
right.
questions.
So the question was, your teacher is going back to school, will you go with them?
That's how I would have interpreted it, but I don't know how every family would have.
Versus, would you like your teacher to continue with what they're doing now, virtual, or I should say remote, or go back to school?
There were about 100 families who wrote some version of what you just said in the text box.
But it wasn't like an easily presented choice. It was something that some people sort of figured out, inferred, and then wrote in themselves.
I believe that's correct.
Okay.
We do have plans for follow-up surveys if needed. But we needed something quick to get out to see if we could ascertain. And by the way, every principal, this data is available for each principal by school, by student, and they are following up with intense phone calls to families to confirm their understanding of that. Many of them have had what I would call open houses, where they've tried to explain to families what the survey meant, answer questions before the survey was given. Each principal had a different way of putting it out, but there was plenty of opportunities that principals had to be able to try to get that clarity for families.
Thank you. Thank you, Madam Chair.
Welcome.
Please
so at
continue.
this time, I think we're going to turn to Jen Petronas, who I think will talk a little bit about nurse prep, and then I'll talk a little bit more on some follow-up.
Good morning, everyone. I'm Jen Petronas, the Director of Health Services for Anchorage School District. And the school nurses this year have been very busy, not only preparing for students to return to in-person learning, but also taking care of those students while they're learning from home, following up with their chronic illnesses and checking to see if they need help and referrals out in the community. School nurses, as part of their preparation, were given medical grade supplies to prepare for in-person learning and when students come back. Everything from medical grade masks and gowns to brand new equipment in order to help out their practices at school. The thing that I do want to note is that we are trying to increase our healthcare capability in order to bridge the gap in our healthcare inequities within not only our community, but ASD students. We do have 14 schools that have telemedicine capability. We're piloting this year 3 schools that will be receiving healthcare services from Providence on a scheduled basis. We already have 4 schools that have school-based health centers. And then we're gonna have 2 schools that are gonna pilot the Abbott ID rapid testing capability so we can just see how that goes. The next slide. School nurses were asked to set up an isolation area in order to separate those students who are symptomatic from those students that are just coming to the nurse for an injury or for medication administration. So this is an example of one school nurse's isolation area. Every school nurse did it quite differently depending on the space they had available in their school, what their normal routine looks like last year, but pre-COVID, just depending on how many sick students they typically see versus how many students come in for routine medications. Like I said, every nurse set it up differently. In most cases, the nurses will be stationed in this area, and then the students that are coming in for illnesses and injuries will go to a separate area, and then the nurse will go see them on an as-needed basis. Next slide. Face covering options seems to be a pretty hot topic within the community. We are asking that all students wear a mask or a face covering. Disposable and cloth mask is definitely the preference. Students can also wear the Humanity Shield, which is the one that goes all the way around the face and encompasses the neck and below the chin. The face shield we have provided for our pre-K through second grade students, and they're going to use those on an as-needed basis for when they're doing phonics lessons or speech therapy or any of those other lessons where the teacher will need to see their mouth. Next slide. And this is just an example of some of the items that we're not allowing students to wear this year, which includes masks with valves, gaiters, scarves, and bandanas. And that concludes my update. I'm happy to take questions.
Thank you. Yes, do you have a question? Mr. Constant.
Thank you. Back to the previous slide. What makes you think that in any way this is going to be enforceable, manageable, or realistic when you have probably a third to half the parents in this town saying masks don't matter, you don't have to listen?
We do have
I can answer that. I can answer that. We will send them home. This is serious. We've announced this. That was a great question. Since July, I've been very clear, very constant. We will ask you to put your, or we will remove you. We have experienced that already. We have taken employee action against our own employees who have refused, as well as when we did have spectators at our sports programs. Those that wanted to come into our gyms, if they took them off, we exited them, even though they wanted to watch their children. We take this seriously. This is a must for us. We have other options if you choose to express yourself by not wearing a mask. But if you're in our schools, we want you to wear your mask at the appropriate times. That's a great question, and I want to be crystal clear with everyone that it's a serious one for us. And as you know, even though ASA backed off of their sports, ASD, while we play sports, currently going on gymnastics, volleyball, and swimming, they wear them even in competition. The only time they don't is when they're in the water, but on the deck, they put them back on. That's a great question. Thank you for it.
Thank you.
Okay, please continue.
Thank you. So this is Mark Stock back again. So real quickly, we'll go through some of our planning to show the level of commitment that we've got to this process. We started our planning focusing on principals' needs. We wanted to give them the tools to find their information. We wanted them to be confident that they could provide a safe and healthy return and give them the tools and the processes. One of those resources, next slide, that we use, we call it the Administrative COVID Resource. This is just a tiny little screenshot of this massive spreadsheet. But what it does, based on the requirements and the needs that were developed by various principal working groups, we built this living document. It's updated every day. It tracks the director's approval of the procedures that are going on, tracks internal and external information. On the far right, you will see categories that say documents or procedures or tools that are in draft. They have been internally vetted. You'll see a checklist. You will see it's being ready for external publication. Then it is finally vetted again by someone who owns and is personally responsible for the content. And then it is then transferred to what we call the Back in School website, which we'll talk about in a minute. And then you'll see another tab called Secondary, which is just to let everybody know that irregardless of what decisions are made going forward and everything, that we must plan for the future. And so following right along behind elementary are all our other grade levels and secondary groups that are in planning stages based on what actually happens going forward with COVID. Next slide.
Actually, Mr. Stock, we have some questions. I placed myself in the queue. If we could go back to the last slide, please. Thank you. So my question, based on this slide with the back in school planning, is there an intention once those are posted on the websites by school to do another survey when parents and families get the opportunity to see what the back in school plan is, or to otherwise provide feedback or update their choice from the initial survey data?
Yeah, I can assist with that as well. We have schools that are actually having parents come in because we want them to read it, but we also want them to see it. So they're having tours at different times. Some of them, if the parents can't make it in, would be electronic to show them a picture of it, a video of it, but invite them in. Basically by the choice of what they would like to do. If they're ready to come in, we're certainly, welcome them, but we also assist with other choices if they decide to go ahead and hold off. So essentially, our constant communication with them from their teacher of preparing is doing that. So it's not going to be this third-party survey. It's actually teacher to parent, parent to, principal, teacher to principal, understanding who is it that wants to come in. But many of these tours are going on with teachers of their classrooms, individually with families, so that they can answer their questions. So that's a great idea, because anytime parents, we want them to feel comfortable offering them the opportunities, but certainly having an alternate program if they're not comfortable.
Thank you, Dr. Bishop. The reason I asked the question is because you provided some data, even if it's anecdotal data based on a survey. So if we're not collecting that, again, it's hard to compare potentially. Ms. LaFrance has a question.
Thank you, Madam Chair. And my questions are a little bit all over the place as I've been reading through the white paper and some of the information that we received. And so my first question is concerning teacher, administration, and staff feedback. How have their concerns been integrated? I know we saw, or the district went through the survey from parents, and I saw in the white paper that teachers and staff have had the opportunity to see and to reflect on current plans. And we have certainly been receiving a number of emails with very specific questions, and I'm wondering what kinds of communications and process is there for integrating those. And then later, I'll just do my second question. At some point, if Dr. Bishop could speak again to the issue of students' needs and how that's been determined in terms of the online learning, because we've also been receiving, quite a bit of feedback from parents who are very pleased with the online learning. Some are not, and there are different levels of frustrations, of course. But if someone could speak, to the data and how that was assessed, that'd be helpful. Thank you, Madam Chair.
So this is. Thank you, Dr. Bishop. Yes, so a couple of different things. Number one, planning groups have involved literally hundreds of people, and I think we need to sort out some of the differences between the leadership groups that must do overall planning, take options, call them down, take them to groups for feedback and vetting, bring those back, work on them. It is an iterative process. And so what happens a lot of times is when the groups come back with options and decisions and different kinds of implementation, let's sort out the difference between I agree with it or like it and whether I had involvement in it. A good example is every single elementary school had levels of participation from folks at the building level. District provided the criteria, the standards, the things that had to be in it. It was a 10-page document that outlined many different things vetted by health professionals and vetted by others, and those criteria had to be met. Because of our facility differences, there's different variations of how different schools are going to be able to meet that criteria or standard. And so faculty were involved in that. Again, it's a big district, so there could be levels of differences in how principals did that job. The directions were their leadership teams worked together on it. Those leadership teams included nurses and included the teachers and so on. And what comes out of that iterative process, I can guarantee you that there would be differences of opinion from folks coming out of that as to how comfortable they were with the group's decisions. But for anyone to say that folks were not involved in any of that, I would question that, but I do agree that they don't always agree with what the groups came out with.
Madam Chair, may I ask a follow-up?
Yes, please.
Well, I'm a little bit confused by that answer. So that means that teachers have been involved. And one of the reasons why I ask is, you know, I have a sibling who teaches out at Matsu, and they had a lot of problems with their rollout. And teachers, for example, were not given PPE. They weren't given microphones. There were a lot of suggestions that individual teachers, you know, had that I think would have strengthened the entire rollout. And, you know, I will also say that my family member tested positive for COVID, got it from a student, and, you know, is still home recovering. So I think I heard you say that there have been a number of folks involved. And I just want to make sure that, you know, some of the suggestions that teachers are making, because they know their students and they know their classes and they know what they need, are being considered. Thanks.
Yeah, I would say that is important, and I'll add on those that were able to take a tour of a building, talk to a principal and teachers that had that experience. And they even shared that even though they were comfortable, somebody else on their school wasn't. And, you know, because a lot of this is personal, but you can see the iterations of their PPE as well and their protective other mitigation objects. There were some that were purchased by the district, but they wanted larger or different. And so this is really, as you suggested, Member LaFrance, a classroom by classroom ability to try to meet those needs. One that was continuing, wasn't finished yet, but was in the process, was a special needs teacher that said, I have to get close to my kids. I have to sit close because I do one-on-one, but I need a different kind of, you know, protective shield. I need it taller. I need it wider. And so each of these are being answered as much as we can. Our PPE, just for masks, for instance, we probably presently, we have hundreds of thousands of masks in stock. Some of them are the surgical masks that you might see that come out of the box there. But we also have cloth masks. We also have probably 4 or 5 different plastic types of masks for staff, simply because those requests came in over the summer. And a lot of them came in from our special education, speech, occupational therapists, understanding the students' needs of whom they'll work with. And so our ability to source these has been nonstop. As we learn of a new technique or a new innovation, we can share squirt bottles that we purchased thousands of squirt bottles to make sure we had lots in every classroom. And then a new one came out that had an electric, you know, battery operated, and it could, so that your finger didn't get tired. Now we're sourcing those. We're having 5,000 more come in next week. And so it's really a process over time. We are a large district. Like I believe Janet Johnston shared, the epidemiologist, some things are harder to source than others, but we do have that, and I think we're going to get right to it with the PPE. So individually, absolutely want to work with them as much as humanly possible, as much as we can. It's important for us, for our staff, to feel confident in the processes. And so that's why we've really had the standardization at the district level and a customization at the buildings level. But how people are in that staff, in working together in their leadership team, would really depend on how quickly they moved and how much they're working together. And so we're here to support. We have the resources, we have the manpower to support, but it's a process to go through to get to that place where teachers are saying, okay, I get this. And you'll see more and more our K-2 teachers a month ago had many of the questions that our 3 through 5 and high school teachers have now. They just haven't been through the entire process. So it is important that we work together to get it done. So thank you for noticing that.
Thank you, Dr. Bishop.
Thank you, Ms. LaFrance. So the queue is filling up. Mr. Stock, how many slides do you have left here? Do you have an estimate?
There's about 9 or 10 left.
Okay, well, I think we're going to just keep going with the queue, and maybe some of these would be addressed by the slides. But so Mr. Weddleton, I believe, is on actually the public-facing side of this meeting. So he's got 2 questions. We got a letter signed by 37 nurses that says they are not ready. Will they be in 12 days? And his second question is a plastic face shield allowed instead of a mask?
Jen
So,
Petronis can jump on.
So I'll address the face shield question first. For students, the plastic face shield is allowed in special circumstances for short periods of time, such as when the students are doing phonics or speech therapy, or any lessons that involve where the teacher will need to see their lips moving. And in those cases, they'll not only have a face shield, but they'll have plexiglass barriers in between for that additional safety. In regards to the letter that the school nurses wrote about not being ready, it was more specifically that they were concerned about the healthcare capacity for inpatient and ICU beds, and not necessarily that they weren't ready to take students in at ASD. All of our elementary schools are set up already with their isolation areas. They have all the PPE that's required.
Thank you. And in the spirit of this being a collaborative, would the epidemiologist or Ms. Harris like to address issues or concerns raised about healthcare capacity and the return to school?
So this is Dr. Johnston. Certainly we're seeing an increase in demand for hospitalizations. However, most of that is related to older individuals and individuals with underlying health conditions. So I'm not overly concerned about the marginal increase that we would see in hospitalizations due to schools opening. We have transmission everywhere. It's unclear how much more transmission there'll be with schools. I also suspect that families where there are high-risk individuals in the households may be less likely to send their kids back. So it is worth thinking about, but I'm not sure that I would see it as a driving factor.
Thank you. So next up in the queue, we have Ms. Allard. Please go ahead.
Thank you. Can you guys hear me okay?
Yes, we can hear you fine.
Okay.
Thank you.
Thank you. Ms. Zolotel, I just have a couple of questions, and then hopefully whoever can answer can chime in. So the first one is in regards, I guess this would go to Hydina, Dr. Bishop. The first one would be, how has this affected our Title I schools in regards to children being able to get food? Because some of them do have school lunches. How it's affected suicides, how it's affected mental health as far as depression and other issues with our children being out of school. That's the first question, and I'll let you go ahead with that, Dr. Bishop, if you could.
Sure. Thank you for that question. And, you know, it really isn't a surprise. I've been criticized for my emotions around kids. And, you know, we were briefed yesterday by Dr. Zink that statewide we didn't have any increase in suicides, but I experienced in the last 6 here in ASD, we had 3. And any one of those is too much for me. In regard to just social services in general, our community has asked really schools to fill that gap when things aren't met at home. We know that children are born into many different families with many different means and abilities to be able to rear a happy, healthy child that we want to be part of our community and a participating member. What schools do in the term Title I is fill those gaps. What we do know is that last year at this time, in regard to our interventions for students who thought of self-harm, it was over 200. Just anytime a kid felt sad or somebody responded, we had over 200 in the first quarter at our secondary schools. We've done under 30 thus far. So for us, the fear is really students in our schools not being able to meet their needs. And so A lot of times that is, although one of our suicides was in elementary this year, a lot of times that is the secondary, and we want to meet those more. We have a Gaggle program that picks up that kind of thing. So kids that turn and use our email address, we can search for any of those things to help parents and our healthcare professionals. What we have learned from a pediatric doctor that actually to our board, who works at the emergency room, said, you know, they have had a couple of cases of COVID come in children with underlying conditions, as was mentioned. But what they're seeing is a miss in those chronic illnesses that they thought that the stressors of just families, whether they're having to go to the emergency room for diabetes and other long-term chronic care issues that school nurses work with families on, whether that's medication at school, the regulation, things like that, especially in the young children who don't regulate things themselves, they found an increase. In regard to food, I'll just share, I don't have the numbers, but in regard to just the number of meals that we serve, again, of our 59 elementary schools, 26 of them are title schools. Half of them have students that are at least 75% of that school are on free and or reduced. So there are significant pockets of poverty in our community, and understanding the need out there is really part of why we really want to do something for those that don't have a voice. Otherwise, I wish I could do more, but given the numbers, you know, when we talk about suicides and other mental health, I know it spans the whole gamut, even into adulthood. But what we know is that a lot of those ill effects of society can be turned around with education. We've known that, and education is the great equalizer. And that's why we don't want to miss out on the K2 kids, because I'm telling you, data demonstrate if you don't teach kids by third grade they're sound at reading, it's very difficult to get them there. And generally, United States, we've failed at that nationwide to get kids moving beyond that level. Thank you for the question. I might have gone a little long because I'm pretty passionate about it.
Ms. Aller, just one quick second before your second question. I'm just going to do a little time check here. We have three other individuals in the queue and to get through this presentation, plus some other individuals to speak briefly. So Ms. Aller, we'll do your question and we'll save the rest of the questions for the end of the presentation, just keeping in mind that we need to move kind of swiftly from here on out. Thank you. Go ahead, Ms. Aller.
Thank you. I would like just to quickly respond to Dr. Bishop. I'm not going to name names. I did speak to a medical professional within the administration, our administration, acting mayors, and it was clear to me that the consequences to keeping the schools locked down as depression for children have gone up. I'm fully aware of the 3 suicides, a 10-year-old, a 13-year-old, and a 15-year-old, all within the last 5 weeks within the Anchorage School District. He recommended we opened up the schools, but the individual was not willing to come out publicly and say that because of repercussions. Then the last question is, I understand that some of the teachers might be saying we don't have supplies in the classes right now, but we are going to get the supplies in the classrooms. Are we just waiting to have that happen so nothing comes up missing and that we have accountability for those?
That's a great question, and we do have them. They are there. We're just going to flip to the slide that how we know and how we track it. It is true we didn't dump everything in classrooms right away because we weren't utilizing them. But as you can see, I'll have talking about the PPE, how it's tracked, where it is, how we know about it. Thank you for the question. Next. Tom, perhaps you can answer that.
Thank you, Dr. Bishop. I'm Tom Roth. I'm the Chief Operating Officer. So real quick with regards to the personal protective equipment and the sanitation and disinfection supplies. So this has been an ongoing process. It's been an iterative delivery of items to schools. I would just submit to Member Allard's question. Yes, the items are there, and it's been delegated at the school level by principals. Primarily when they're going to place those items in the classrooms. Many have already done that. Some have kept their materials either with the BPO or even in the principal's office. But The items are present, and this is an evolving thing. We're continuing to procure items as Dr. Bishop alluded to earlier, and we are moving those to the classroom as we receive them.
All right, please continue with the presentation.
Okay, and let's leave it on this slide. This is Mark Stock again. Just to follow up with Mr. Roth's comments about, I'll talk a little bit more about the process. Yes, we have heard this from employees say things like, well, I haven't seen this item or that item, and they say it's coming, I don't have it. Our principals asked for this tool. This is just a screenshot, but every single elementary school is in our pivot table and spreadsheet here. There's a distribution round of categories. We've done 4 rounds of PPE and delivery. Our principals asked for a detailed analysis so they could keep track. It shows the delivery date, the sum of those items, and even to the point of who signed for it. And it also, like this sheet, this alone here, just for the elementary tab alone, has 14,000 lines of PPE that have been ordered, plus the quantity of those items. And there's 4 rounds of PPE that go through here, and there's a tab for every school, every grade level, etc. So our principals can, in seconds, find out what was delivered, when it was delivered, and then make sure that they have it available. So it is quite possible that there would be an employee here there that hasn't seen item yet. Doesn't mean it doesn't exist or it wasn't ordered. And we now have a follow-up process for if there is in fact something missing, we'll make sure that it's delivered promptly. So moving on, I wanted to back up. If you could go back 2 slides real quick, just on the website Back in School, I wanted to point out that the health and safety items that we've been getting questions about, and their question that had come up about how much involvement do people have, I wanted to point out that it continues to be an effort. Every elementary school's public safety plan is publicly posted as of 5 o'clock yesterday. It has been through multiple sets of vetting, and it is still an iterative process, as we keep using that word, because there are folks who are able to go in and look at the last date it was adjusted. So let's say a parent looks at it, calls their principal and says, I noticed this. I'm unclear about what what is that process? I'm not comfortable. Principal might go in, meet with the leadership team, and adjust something in the plan. It will then show the date and the time in which it was modified. All those are public facing materials. Next slide. And we'll go clear to keep going one more. I'm trying to speed up for everyone here. So this is just an example of one of those, just a screenshot, but since they're all publicly facing, everyone here has access to that. If you wish to look at a school that you are interested in, contact the principal if you have questions about it. Next slide. So I wanted to point out this one very quickly because the detail that goes into readiness for the school. So this is our tracker. It shows when their plan got submitted, which director did they approve it yet or not? This is an older screenshot. That's why it shows some places still white, but it also shows when it was reviewed, when it was trained, when the staff got that. And many of those got their training yesterday, so those would be green now. There's a site visit from the director who's walked the school personally, looking at the plan, talking to the principal, trying to confirm that they're ready. Then there's a document that talks about whether it's gone public facing, a link to the plan, and also whether it's ready for migration over to the public website. So this is just an example of our thoroughness to tracking it internally to make sure that we're meeting our school's needs. And let's go all the way down to the posters and videos real quick. There we go. I just want to show some of the public facing stuff that you all can see with regards to our posters, different videos. There are many of these videos available on the web for families, for parents, for staff. There's also an internal public facing or an internal website just for Support Central for staff to find every one of the things that they would need if they have questions about. And so let's go to the training series on number 25. Keep going, speeding up here. This is, and maybe Dr. Bishop may even want to touch on this one because she took the quiz. I did too, the readiness training that's in the Canvas course shell, but it goes through all these categories. and everything from how the bathroom breaks are handled, how the eating is handled, how sending students to the nurse is handled. Those are the district facing. Now, every one of those have some unique items to this particular site that would be unique to the school, but this training is just the general pieces that go district wide. And I want to do one more slide, the next one. And I just wanted to touch on the videos and things. This is just a quick screenshot of examples that go everywhere from on your face mask. We have protocols for what to do when students don't comply and all of those kinds of things, everything from all the protocols that are all in our video series. And one more slide. This is the support for transitioning our staff and students. And I wanted to point out the questions from Ms. Allard about some of the social and emotional pieces. We have 3 weeks of activities that are blocked out for potential teacher use that talk about dealing with all of these issues socially, emotionally, and behaviorally, including down to lessons, videos, and activities that teachers can choose from to try to help students. We know when students return, there's going to be a lot of time spent dealing with trauma that occurs as a result of this, and school may be their only place where they have an opportunity to get help and support for what's happened since March. And so this is part of our plan, with that, as well as the academic pieces that kids have been missing since March. And that's all I have. There's one more slide that just talks about the tools, and we won't necessarily go into that, but administrators have tools for the sub process, for reentry, for monitoring, for special ed, technology use, et cetera, et cetera. And we've got all those tools built into our documentation for principals. So we believe that we will be ready. We believe that the planning is ready, and now the handoff has gone to the principal and staff, where they are spending the next 2 weeks nailing down all the entry procedures. And that's all we had.
Thank you, and sorry to rush you there a little bit. So I'm going to go ahead and we'll run through the queue here, and then we'll turn to the other, the various unions who'd like to speak briefly. Again, I see quite a few assembly members in the queue, board members. Of course, you are welcome to join us in the queue as well. So the question from Mr. Constant that he left me by phone was, what similarities and differences exist between wealthy schools and Title I schools?
So this is Dr. Stock. I would like to take a quick stab at that, and I would say the differences in terms of people's desire to come back to face-to-face learning are not near as great as people think. Actually, there's only about a 5% or so difference between the families who are from our non-title schools to those that are in the poorer sections. There is a difference. I will say this, that our families who have the least amount of resources are also slightly more worried about coming back. So our principals are working through individual families on how they can support those families, but those are some of the differences. And I don't know if anyone else on my team would like to jump in.
We found initially when we first, it took us about 6 weeks to find out where students would land, because we opened up a new program, virtual. And what we noticed right off is that the majority of students in our lower socioeconomic status areas, or our poorer areas, if you will, as Mark used that term, their classrooms actually had a higher number of kids per class. So we were finding at the beginning of the school year, we had 28, 29 kids in our title schools and classes, where in our schools that had a higher socioeconomic status had lower class sizes. Consequently, which was this move teachers in the middle of the year, change classes. We literally moved 16 teachers from schools that probably were in wealthier parts of town to adjust those class sizes to get them lower and reasonable, to where we had about a mean across the school of about 20. Most younger grades are lower. So initially, that told us the access to online or other programs was very different. Again, we had about 4,000 students leave the district. Many are in our private schools and to enroll in those and some other services. So that left schools that had more means and schools with parents of more means rather lower class sizes, and the ones of less means higher. But we've done some adjustments, which was a pretty rough of about did it about 6-7 weeks in, which was pretty tough. But that's a great question, because there are differences in regard to access to other abilities and equity of access. That's absolutely something that we're trying to mitigate as well, in addition to the virus.
Thank you, Dr. Bishop. Mr. Rivera.
Thank you, Madam Chair. So I have a couple of questions. One is a comment and a question for the school district, and then second is a variety of questions for the health department. So I'll just read both series, and then hopefully we can get responses. So questions about the various testing and screening plans and communications to the public of them, and I was generally happy with the response given. It seems to me that plans are in place. I will say that there are some very specific questions members of the community have on your plans. So if you could communicate those details to the level that we're getting the requests for those details, I think that would help alleviate much of the concern that I am seeing and others are. All that said, it still isn't clear to me and many members of the public why we are even considering this move to reopen given the current trajectory of the virus. You can have all the plans in place, but the virus could overtake all of the prevention measures staff and teachers have been working really hard to implement. To put it plainly, ASD might have one plan, but the virus, and especially the public health measures we are taking to mitigate the virus, has another totally different plan. There are so many additional layers I could add to the discussion, including socioeconomic disparities, racial inequities, and more. But for now, I'm just going to keep the question focused on what I'm hearing most from my constituents. So can you help explain the apparent disconnect and conflict many parents, teachers, staff, and concerned community members are pointing out to us between ASD's reopening plan and the reality we are seeing unfolding around us, especially with the recent public health advisory put out by the MOA. So that's for the school district. For the municipality of Anchorage Health Department. So the MOA has the power to, quote, advise on public health matters. How is the Anchorage Health Department advising the Anchorage School District? What is the current confidence level of AHD in the plans put forward by the school district? And in particular, what analysis has AHD done to show that ASD's plans follow the best medical and scientific advice? Last, ASD has stated that it is AHD's responsibility for contact tracing, and that they, the school district, have no apparent plan B. So what happens if the health department is overwhelmed and unable to keep up with contact tracing for the school district? Thank you, Madam Chair.
So this is Dr. Stock. I'll take a first stab at the first item, which had to do with ASD's response. Why this plan? Why now? And I'm going to couch it around these terms. So there's what I would call a short-term issue and a long-term issue. And let's start with what happened in March. When the pandemic first hit, the vast majority of us in this office didn't realize the length of time that this was going to drag. In fact, when it first came up, most of us were thinking that our students would be out of school for several weeks and we would be able to put together something to get through that time period. You may remember we extended spring break and those kinds of things. And then the reality began to hit the more we began to read, to hear, to learn from experts about what was coming. So we were out for the rest of the spring and we stood up a program that wasn't perfect, but it was remote, had a lot of problems. We learned a lot of things from that. And so here's what's happened over the summer and into now. What's happening is the short-term medical concerns that we all have and continue to have are now being weighted down with many other concerns, many of which you've heard right here. We're looking at the heartbreaking stories that come in every day from families whose kids are distraught, and for every family that they write us and say, this is working great, keep with it. We get another one from someone who's in complete trauma over everything. And I think what it's really shown to us is the vital role that public education plays in this culture and in this community, in this society. And that weight is weighing heavy. And we have these developmental windows. So we've prioritized pre-K through 2 group that is highly vulnerable during these windows of time which we can teach literacy and develop them. If not, we're looking at a multi-generational impact on our entire culture in this country. So what we're weighing as a district is how do we weigh out all of those criteria. That is why, even as cases have risen, we have continued to realize the needs and the crises on the other eye have also risen. So we're constantly weighing those things out. And that would be my answer to that. And I believe you have a question about testing and contact tracing as well.
Yeah. I can transition to our operations team because that is important, and part of our mitigation strategy is we do contact notification. We're in the education sector. We contact our families. We will notify and define what isolation is, are for quarantining and the like. Both of our employees and our students, and our Director of Nursing, Jen Petronas, can get into more detail. But the contact tracing actually isn't our lane, and there's other factors that go into that. But certainly I want our families and our employees to know that notification will happen if you're connected to us. I don't have the purview of someone's job or husband or spouse, grandmother outside of ASD. So we will do our due diligence there. But interestingly enough, around the country, what is happening, Doc said, is there's this joint effort, and you can look at similar districts to our size and transmission rates in other places. One of those that comes to mind is Denver, where they started back up and in October and really had to scale back, very similar reasons for the spread, to be able to just service their most needy that have the least ability to learn on their own, even with a computer. And so understanding the full gamut of issues that are out there, I would say all children, if I could get them back, I would. But right now, with confidence of being able to mitigate the spread and not impacting the city, I share your epidemiologist understanding as well that age group, and evidence demonstrates thus far out of London and other places that we're studying that they don't have the impact that was once thought of schools being super spreaders. With that, I'll turn it over to the operations department to be able to really speak to those testing idiosyncrasies as well as contact tracing.
So this is Tom Roth again. I'm going to ask Jennifer Petronas to a bit to the contact notification process that Dr. Bishop spoke to. Again, we're happy to open up and have a collaboration on this based on Member Rivera's question. So Jennifer, you want to talk to that a bit?
Yes, absolutely. Since school started, we have been performing what we're calling a contact notification process. Once we're notified that a staff or a student who's been in any of our buildings or facilities tested positive, we are working with the principal, the school nurse, and administration to find out who those close contacts are by definition. And we're immediately notifying those individuals by a phone call and a letter that explains, what the definition between isolation and quarantine are, when their estimated release date is based off of their last contact, what the testing recommendation is based off of, again, their last contact with the individual, and then also phone numbers in case they have questions, which would be to Health Services Office and ASD and their school nurse to follow up. Additionally, if we're notified of an individual that already was notified by the health department that they're a close contact of someone, We're making sure to track those individuals as well internally to ensure they don't come back into our buildings before their quarantine period is up, and then following up with them to see what their test results are if they did choose to get tested during their quarantine period. We're also tracking symptomatic, so anyone that comes into our building that says they have symptoms or we have noticed they have symptoms, we're tracking those individuals and making sure that they isolate at home and either get tested or get a doctor's note, or making sure they stay home for 10 days. So what we're doing is a contact notification for any ASD staff or students, but nothing outside of that. If they play Pop Warner football, for example, we're not contact tracing back to Pop Warner football.
Thank you. So I'm going to give the health department a chance to weigh in on that, and then realizing the time, I'd like to, after that, get a motion to extend by 15 minutes so we can hear from the unions and hit the 2 additional questions in the queue. I think we can accomplish all of that with just an additional 15 minutes. But first, health department, if you wanted to address Mr. Rivera's question regarding contact tracing.
Absolutely. So just around contact tracing, or would you like me to address the other comments as well?
Go ahead. Yeah, just
okay.
Address what you brought up. Thank you.
No worries. Yes, absolutely. So as we think about what our community looks like right now and recognizing the widespread transmission of COVID, we are taking that into consideration as we advise and work with the school district, which we've been doing on a regular basis for many weeks and months at this point. And we do recognize the health department that schools actually could be a safer place to be, even though there is with this widespread transmission. And that as the school district really works to implement some of these really strong mitigation practices around masking, distancing, and hand washing, those can actually be contributing factors to reducing the spread and supporting our community in that way. And so we're working with them to continue to just hone in on those practices as closely as possible. And we have been really grateful to the school district's commitment and success around ensuring consistent mask use, as we know that that's one of the key mitigating factors that can be implemented, and as well as the district's commitment to being symptom-free. We continue to work with the district and advise them around social distancing and how the contact notification process will work into the future. As far as evaluating the plan, the Smart School Start Plan is actually approved at the state level, and so that's been a collaboration and connection between the district and the health department with the state as well, as they evaluate what that School Start Smart Plan looks like. As far as contact tracing, our capacity at this point is limited, and we've shared that regularly from the health department perspective. And so we are recognizing that there's often a backlog of cases at the state level that we're still having challenges in reaching in a timely manner, and there's a lag time between reaching cases. And so as our cases rise and our capacity around contact tracing reduces, it's very likely that we will lean into this space where we are contacting index cases and asking them to reach out to their close contacts, except for high-risk circumstances. And so that is a factor to take into consideration as we think about how to return, and that the contact tracing and those close contact communications are likely to start being really initiated at the COVID positive level of the index case.
Thank you, Director Harris. At this point, before I turn to the unions, I would entertain a motion to extend to 11:45.
So moved.
Is there a second?
Second.
Great.
Allard.
Thank you. Is there any objection to that extension? Great. As anticipated, we were going to be pressing the clock here today. At this point, I'm going to start with the AEA, but we also have other representatives. I'm going to ask that if unions can try to keep their comments at about 3 minutes, that should accommodate everyone, and then let us get through the last 3 individuals in the queue. And with that, I would turn that over to AEA.
Hello, thank you. This is Corey Aist, President of the Anchorage Education Association. I just want to make sure I'm being heard. Hello?
Yes, you are. Please go ahead.
Thank you. I submitted some slides for testimony, but I was not able to log in through my computer, so I'm just going to speak and the slides will be public testimony. I have a couple of things to share. First, it's a bit uncomfortable to hear the characterizations of teachers and classrooms and nurses. I think that some of that is mischaracterized, and it's troubling. I think our community is in a really precarious situation. I think we're getting mixed messages from our health professionals for a variety of reasons. Last week, Dr. Chandler stated no gatherings are safe, period. Dr. Zink stated, please avoid all activities with people outside your immediate household, especially all indoor activities. And that was on October 25th. And the pandemic has just gotten worse. The community is confused. I believe that the timing of this plan is off. And although the district has done lots of work, I do give lots of credit to Dr. Stock, Dr. Bishop, and their team. The timing is off, and it's inconsistently applied throughout the district. Just this week on Monday, I met with nurses. 18 schools, they've reported in their survey, 18 schools are still not following mandates, and 6 additional 14 are inconsistently not following district protocols. That has been a consistent issue that I've actually had discussions with Dr. Bishop about for the last several months, and don't blame anyone. It's just the perspective of our community, and it's very challenging, and it's not any one particular union. It's all over the map in terms of who's not participating. In regards to so cost to the community, this is really hard. This situation, the plans that are in place marginalize the efforts. When you put words in a safety plan like if possible, when possible, that basically is an out for not following the plan. So I could share, I'm receiving tons of pictures where classrooms are not, where students are not 6 feet apart, tons of spaces where they're crammed together. The plan, the schedules in which these students are going to be at school, long periods of time sitting at individual desks. These are kindergartners, preschoolers, first graders. These students want to move, they want to socialize, they will move and they will socialize. The human factor is going to be the issue, not the protocols. The human factor, complacency, fatigue. I taught kindergarten for 5 years. I sit with those kids. I point to the books. We do read each other's lips. We do a lot of things that are social and in close contact. And so I've shared a couple pictures in those slideshows of what school should look like and what classrooms, at least right now, are being designed to look like. Lastly, I'll just, context matters. I've heard the Harvard study being brought up several times, and depending on the metrics that we're using, the state says the city, Anchorage, and the state is red, or at least the state is 90% red. Our caseload is out of this world. When we talk about other schools, other areas, Los Angeles is 9.9 to 100,000, or somewhere in that neighborhood. New York, Broward County is at 26. We are astronomically higher in terms of our spread. And I want to point out the Harvard study puts everything in context, just like the pediatrics physicians did this summer. This only works if the community has spread under control. And I think our health professionals are telling us we don't. And we do not have any mitigation plans in place in the community to help bring the spread under control. We're just entering the winter months. We're entering the holidays. The timing is off. Their teachers are screaming, please do not do this. And I have a lot of concerns on whether staffing will even be available on the 16th if the plan is still in place. Thank you for your time.
Thank you. Please stay on the line in case there are questions at the end. Now I'm going to invite APEA if they would like to share some comments.
No, I do not have any comments at this time. I think a lot have already been addressed. Thank you so much.
Thank you very much. And I appreciate that you're on in case there are questions. Next, Totem, if they would like to share any comments.
Yes, good morning. This is Sandy Thompson, the president of Totem. I represent the classified support staff, which includes your clerical, your tutors, and TAs. As Corey stated, you know, there is a lot of concern from our folks about plans, protocols, what the district is saying about, you know, sending kids home when they're sick, sending, you know, folks home if they're not following masks and that type of thing is of concern. And a really big concern has been expressed on what will our support staff roles be if there is no teacher in the classroom or if there is no substitute available. And it has been expressed through some of my members from the principals that, well, we'll just have a TA cover the class or a tutor cover the class. And I brought this forward to the district that that is not acceptable. There has got to be a plan in place when we don't have the staff to cover in that certificated role. It cannot fall to the support staff to fill that place. And of course, you know, we have a lot of single families. We have a lot of multi-generational families. Bringing in K through 2 to try this out is great, but I'm a elementary teacher that teaches 4th grade, and I have a 1st grader whose school is not going to open. You know, what do we do? I think we're putting staff and families in a really precarious situation to either come to work, which a good majority of them want to do. They want to work. They love what they're doing. But can I put my family at risk? And a lot of times the answer is no. And if I don't work, then how do I put food on the table? Especially those single parents out there are really facing a tough time. So, you know, I understand the districts want to get kids back in a classroom. That is where they learn the best. I think the majority of us absolutely would agree with that. But is this the time to do it? And can we do it safely for everyone involved? Thank you.
Thank you. And then the last union we have joining us is Local 71. Would you like to speak? And please introduce yourself. Thanks. Okay, not hearing anything. So I'm going to go ahead and jump back up into the queue here. This will probably take us right to time. Mr. Dunbar, please.
Thank you. I have 2 quick questions for Dr. Bishop or anyone else at the school district. So the first, has there been any, have there been any cases of spread or transmission within the schools these last couple of months? That's one. And then 2, you know, I appreciate the answer you gave us in that white paper I was reading through there regarding you obviously are giving parents the option, either you send your kid to school or they can go to this virtual program. I'm curious, why didn't you, or are you willing to give that option to teachers and staff? So the answer on this white paper is that the only way for teachers to not go into the classroom is to burn off their leave or to resign. Have you considered making it optional for those teachers that maybe live in a multi-generational home, or they themselves don't feel comfortable for whatever reason? Thank you.
Sure. Thank you for those questions. And I am going to request those that work in those fields, those sectors, the medical sector, as well as operations in regard to cases, because as you know, we've started reading programs. Our teachers are coming to us. Just want to let everyone know the parking lots are full because our teachers prefer to work from work, many of them. They do come to the buildings and as well as we've had sports programs. So we want to, we can talk about those and our experiences with those and cases and what we've done and what we have to support that. And then I would appreciate, I know that Matt Tiefert, our Chief of Human Resources, is on the phone as well to discuss those. And again, many of the answers aren't going to be ubiquitous because each, as you know, Member Dunbar, each bargaining unit has their own contract. So the provisions allowable are very detailed to those contracts, but I'll have Matt Tiefert be able to share that as well. So we'll start with the health questions and then move to the employment questions. Thank you.
So if I might, very briefly, I'll talk to the case question. So to be sure, over the last couple of months, we've had activities where we have received reports of individuals, either they're confirmed positive COVID cases or they have symptoms. So Mr. Dunbar, you know as well as I do, based on people interacting across the community, there's no way for anyone to determine with any certainty that transmission is occurring in any given location. We've had people in and out of buildings, but by and large, what we have experienced is that we are responding to people who are either coming to school buildings or activities that they are either confirmed COVID at some point, and then we address the contact notification that we've discussed, or if they're symptomatic individuals that we suggest those people get tested and they're not allowed to return to the district until such time that they have either resolved their symptoms and have demonstrated that they're COVID positive.
Was there any follow-up to that quickly? Or was Mr. Tiefert going to address the second part of that question?
Thank you, Member Zalatow. Yes, Matt Tiefert is on the phone.
Yes, hi, this is Matt Tiefert. I'm HR Chief for the school district. And Member Dunbar, to respond to your question about how we're approaching staff returning into school programs. As we did indicate in the written response, the primary focus is on the contractual leave that's available to staff, and it does vary, as Dr. Bishop mentioned, based on bargaining unit. So we're paying close attention to what those negotiated agreements allow, and are also being very flexible in our approach to both requests for accommodations for those employees who indicate they are not able to return because of a medical condition or the like, and our Office of Equity and Compliance processes those requests. And similarly, our leave office has been given direction from the labor office, my office, to process extended leave requests for teachers in a more open fashion. We do have guidelines in the contracts that we've relaxed so that staff, as they're considering whether to come back into the schools, who might want to instead choose a period of leave, can do so. We do, of course, rely on our certificated and classified staff to operate schools. So we haven't gone to a strict volunteer to return approach. but we believe that the flexibility that we've put into place around relaxing leave provisions has provided ample opportunity for those employees who aren't able to return because of a medical concern to exercise those options.
I'll ask a quick follow-up to that, Madam Chair.
Yes, quickly, please.
So we don't understand this virus fully, but we do know nearly every time that there is a hospitalization or a death that it's reported there was some kind of underlying conditions. The underlying conditions are very broad. So does that mean, 60% or more of teachers, or why not just for the policymakers, why not just allow all teachers to say, I don't feel comfortable, my medical concern is COVID-19, and I want to continue teaching remotely? And then, the same thing for staff. Why not give them that option?
Member Dunbar, again, Matt T, for responding. I do understand that approach. The reality is that there will be, we expect, a number of staff who report exactly that because of some underlying condition, they do not feel comfortable or not able to, because of medical advice, return to schools. And we do have a way of processing those requests and have indicated there won't be any penalty for staff who might otherwise have missed a deadline for giving notice of intent to take leave. So we do feel like we have provided opportunity for them to go through that process, and for those who do have those underlying conditions identified by medical providers, they'll be able to take leave. In terms of continuing in remote delivery, there are some positions in the school district through the virtual program and others that continue to work and will continue to work in a remote capacity. But for those operations at school sites with children to operate efficiently, we're going to need folks in the buildings, obviously, for that supervision and instruction to occur there. How it breaks out, it's very difficult to tell. We're monitoring every day, what level of leave requests we receive, and haven't seen a jump in recent days, but we're tracking that closely.
Thank you, Madam Chair.
Sure. Thank you. Question from Mr. Constant that I'll read. What preparations are being made for lawsuits due to illness and possible death of teachers who are forced back into classrooms? Will settlements be self-insured or fall to the taxpayer? And to the health department, what's your confidence in ASD's plan? And I know none of those are probably super short answers, but let's do our best. Thanks.
Sure. Thank you, Member Zalatal. And I will just have to share that we will get back with you in regard to with our general counsel. Our board, again, there's many laws and services around just having a service for people and for the public, and provisions and laws around that. So I would hate to misquote anything, but in regard to liability and the like, we certainly will get you those answers in a written fashion.
Thank you, Dr. Bishop. Director Harris?
As far as confidence the health department has in their plan, I'd say we are confident that the administration is working to implement the best practices that can be shown in schools. And so we have confidence in that. It's difficult for us to say that we have confidence in each of the plans because as the superintendent shared, each of the classrooms could look different. And so we don't have an eye into each of those classrooms. And so we encourage people to be thoughtful and continue to ask these important questions about what each of those classrooms look like throughout the district.
Thank you, Director Harris. We have Ms. Allard in the queue, and then Ms. Marcette, and then we will end. Ms. Allard.
Thank you. I just have a comment. I wanted to tell Dr. Bishop, the school board and staff and all the medical experts to deal with the ASD that I trust your decisions as experts, and that I'm going to continue to support that. I also wanted to say that I've had many educators that have spoken to me in regards to opening up the schools, but they're scared to come forward because of the repercussions of the unions. Then my final two little comments is that we have TAs and substitutes wanting to work, and this is why we have subs and TAs, is to fill spots as needed. And I'm going to go here. The daycares are open, fully open. And if their daycares can be open, our schools can be open. And I also believe I heard, correct me, maybe I'm just going to make a comment, that AEA, Mr. Ace implied a walkout or a sick out. This is about our children, and we need to do right by our kids. And if 80% of the families are standing by this, then I think we should support that, and the assembly needs to stay in their lane. Thank you.
Thank you, Ms. Allard. And I apologize, I missed Ms. Mitchell from the school board in the queue. So quickly, we'll do a question from Ms. Marcette and then Ms. Mitchell.
So my question is, we're talking about the school board opening up, but if we put our priorities in lowering the numbers within the community, we can have schools open. And I guess I'm not seeing that. I'm seeing, people in Costco and Fred Meyer's walking around not being approached. I see outside activities where people are not wearing their mask, bars and restaurants. We know that those are high areas of spreading this virus, and yet they're still open. So, my question is, why hasn't the assembly prioritized education and approach some of these others to bring the numbers down so that we can get our kids in school? And then the only other thing I would say is, when we talk about our teachers coming back to work, I mean, I don't know where nurses, doctors, grocery workers, all essential workers have the ability to tell their employees how and when they'll return to work. This is about our kids and doing what is best for them and showing up to work.
Ms. Marcette, did you have an individual you'd like to answer your first question? Either some of the administration or who?
Well, I would like to know, what is the assembly going to do to lower the numbers, or the mayor's going to do, or even if they're, we're talking about opening schools, but we're not talking about lowering the numbers so that we can, we want to get our kids back in school. And I don't believe the local government or the assembly of the municipality has made that a priority, given that we still have our bars and restaurants open. And we know that it's less safe in the community than it is in the schools.
Gotcha. Thank you. Director Harris, could you touch on that briefly for us?
Absolutely. So as far as what the mayor or the administration and the assembly might do around emergency orders, I'd have to defer to them. But the comments are taken into consideration, and I think are very relevant. We do know that schools can have mitigation practices and have shown that it's potential to have lower risk and transmission than we had originally thought. And so I think it's an important conversation and dichotomy that we have when, as was mentioned, bars and restaurants are open. Private schools are still in session, and our daycare facilities are open. And so I think it's important for us to work with the school district to figure out how all children have access to education. It is, we are seeing in some other parts of our community.
Thank you, Director Harris. So the last question goes to Board Member Mitchell, please.
Thank you so much, and I really appreciate the time everybody's put into this. And to Member Marcette's comment, it's true that schools are so much than just a place to learn. It is a place of safety. It's a place that provides childcare. It's a place that provides love and confidence in that child. And so there are many, many reasons that we would love to get schools back as soon as possible. One of the reasons that the administration has talked about is the suicides, and I'd heard allusions to that, but I had not heard numbers. So Member Allard, thank you for informing me that there have been 3 suicides. I had heard rumors that there were 7. So what I did is I reached out to the epidemiology department at the Department of Health and Social Services, And I have a chart in front of me that says that so far, year to date in 2020, we've had 2 suicides in Anchorage in the 10 to 14-year-old range and 2 suicides in the 15 to 19-year-old range. And no suicides are acceptable, but we don't know that those would not have happened had school been in service. And we also know that in prior years, in the 15 to 19-year-old range, 2 is still low. Of course, we still have 2 months to go in the year. And it's interesting when we look at all of Alaska youth suicides. In 2017, there were 21, 19 in 2018, 32 in 2019. And year to date through the end of October, only 11 in 2020. So those are absolutely numbers that we should take into account. Mental health is critical, and we do provide mental health services in our schools. We also know that some students are experiencing positive mental health because of this. Students who are extreme introverts who are being bullied. So I think as a community, yes, those are issues that we want to address. And is sending 9,000 students to school right now the answer to those issues? I don't know. I just want to put that out there. And as I think about this, COVID is really widespread in the community right now. I know of 2 young people who have lost their parents to COVID, elementary age students. So we're going to have 8 school days before Thanksgiving. So we're going to have students coming into schools, bringing their what they have. And we know through the University of California, San Francisco study that they did nationwide that the incidence of COVID among children is basically the same as the incidence in the general population. It's just that they don't get tested as much. So we have 8 days where those kids are going to come together in school with their teachers. Then they're going to go, and I'm guessing because of human nature, Thanksgiving is a holiday that is about gathering friends and family and eating. And so I'm concerned that they're coming together, then going out into those pods that may be expanded, and then bringing that back into the schools for another 14 days before we go to another holiday that is all about gathering friends and family, and it's a longer holiday, and it's around food. So that dynamic concerns me greatly. And when we talk about mitigation, I've been in 7 elementary schools over the past 4 days, and they are just doing tremendous work. They are really, really taking this super seriously, with a couple of exceptions. And I've seen distancing where the kids are going to be at 2 feet apart to distancing where they really can be 6 feet apart. We know the guideline is 6 feet. We know that people are not supposed to be gathering in spaces. So I guess with the rates as high as they are, and with all of these dynamics of the holidays and going in and out of school to holidays, I am concerned about being in a classroom for 5.5 hours where the kids are going to be taking off their masks to eat lunch. And yes, they're being told not to talk during lunch, but we know that eating is really a key way that this gets spread. So I do have my concerns. And I think that the things that we're trying to address absolutely can be addressed in school. But as we heard, school is not going to look the same. When children my heart breaks for kindergartners learning that this is what school is. However, with the Zoom, they can, if the teacher has COVID, if kids in the class have COVID, they can still all come together on Zoom and they can get up and sing and dance. When they're in that classroom, they have a space and they're confined to that space. And it's not going to be the kind of experience that we think of in school. So I think that there are possibly other ways to address the concerns that we have, the mental health concerns, the childcare concerns that we have that don't necessarily involve bringing all of our kids back right now. And I'm not saying I'm against that. I'm saying these are the issues that run around in my head, and I'm hoping that the school board has a special meeting, because I don't think we've really had, or at least I personally have not felt that we've really had a chance to fully discuss all of these nuances. So I wanted to share that, and I really appreciate everybody's time and sincerity and concern about the health of our community. That's obviously paramount, and it is the physical health from COVID as well as the mental health and all of the other things. Thank you.
Thank you, Board Member Mitchell. So we are over time. I'd just like to say I'm hoping that school board president and the chair of the assembly can maybe confer and we can have the opportunity to continue these joint conversations. With that, I would entertain a motion to adjourn.
So moved. Constant.
Great. Thank you all. Have a great afternoon.